For the fifth media submission, I'm going to explore how utilitarianism played a role in one of the biggest events of the last century, the pandemic. To start, utilitarianism, as covered in lecture, is a principle, rule, norm, or institution created by Jeremy Bentham and modified by John Stuart Mill that is justified when it is to the greatest benefit of the greatest number. One example of this playing a part in the pandemic is through lockdowns. One utilitarian rule of thumb is to save the greatest number of lives, and here this rule can be applied to lockdown by assessing how many lives would be lost if lockdown is applied or not applied. In many states, such as Michigan, lockdowns were put with the public health goal to save the majority population from COVID-19 and to prevent overwhelming healthcare systems with patients. Other examples include mandatory contact tracing, mask wearing, and vaccinations, all on the grounds of freedom of choice, bodily autonomy, and personal rights in order to benefit the majority. However, lecture also stated that utilitarianism is problematic because it might license, even require, the sacrifice of minority preferences to benefit majority preferences. In the context of the pandemic, this played a part within a common unethical practice in which decisions such as who should receive a ventilator. Some state pandemic plans instructed hospitals not to offer mechanical ventilation to people above a certain age or with particular health conditions. Here, some sick minorities are sacrificed for the pandemic-related majority. Overall, the COVID-19 pandemic created a unique set of challenges for national governments. It constituted not only a medical challenge, but also a moral one. It created unique conditions in which the need for utilitarian thinking was made obvious.